My child has a lot of cavities and they need a long dental procedure done. Can they be sedated? I'm Dr. Olga Dolghier, board-certified pediatric dentist and sedation dentist here at Palm Valley Pediatric Dentistry. Let's discuss this topic. What are oral sedations and what is the criteria for oral conscious sedation? Number one, we want to know the age of a child. We can sedate children only after the age of 3, usually 3.5 and up. If the child is too young, unfortunately, we cannot sedate them because their airway, their tube where they're breathing through, is not developed enough. Also, they may not cooperate with all the efforts for oral conscious sedation. Number two, we also need to know medical history. If your child has severe illness or any other medical problems can interfere with his breathing or heart, we absolutely cannot sedate their child in dental office. So medical history is extremely important. Number 3 is behavior. If your child cannot sit in a dental chair for simple dental cleaning, they cannot take x-rays at all, and they need intensive dental work, we won't be able to do conscious sedation as well. Also, another criteria we look is airways. We check the size of the tonsils. If your child is snoring, gasping for air at night, has sleep apnea, or has large adenoids or tonsils, we won't be able to sedate your child as well. So ruling out all of those problems and finding the ideal candidate is the key for success. If your child needs intensive dental work done, they are healthy, they're relatively cooperative but still fearful, they have good airways, no medical issues, then they're good candidates for oral conscious sedation. So what to expect during that procedure? You come back on empty stomach. For us, there's nothing to drink from midnight, and loose clothes, comfortable clothes with 1 or 2 parents, ideally 2 parents. Then we'll give them medication by mouth. Medication usually does not taste good, so we actually use different type of sugar-free sweetener to make them taste better. Child drinks the medication, and then we wait about 45 minutes to an hour until medication starts affecting your child. After that, we take them back. We take them to operating room. We hook up multiple monitors. We monitor their heart rate. We're monitoring their oxygenation of their blood with pulse oximeter. We monitor blood pressure of the child. Also, sometimes we use capnography, which tells us how much air they're breathing out. So that's a more specific way of monitoring if they're struggling to breathe. And then we start doing local anesthetic, numb the mouth, and do dental procedure that way. A lot of times we can do all treatment at once if it's not too much. If it's 20 teeth, that's a whole different story. Usually we can do 2, 3, 4 quadrants of dentistry. A lot of times we do half of the mouth and then come back for a second half of the mouth for another oral conscious sedations. It depends on the skills of the provider or dentist and also of child's behavior. If at a certain point your child wakes up, gets upset, crying, then we stop. We don't force kids. And then we reschedule you for a second sedation appointment. So sedations we take extremely serious. When procedure is done, we monitor vital signs, we check the child awakeness, alertness, letting them walk a little bit, give them a popsicle to suck on, and then if they feel good, we can let them go home. Our team members always call our parents at the end of the day and check on the patient, how your patient is doing, how are they feeling okay or not. Also, we'd always discuss the pain management, which is very important because some kids are sore and they can be upset. So ibuprofen, Tylenol, those are medications we usually advise for oral conscious sedation after the procedure is done. So oral conscious sedation is very commonly done. But if your child does not meet those criteria I just described, we usually go through IV sedation or general anesthesia in office, which we can provide as well on a healthy children. So that's how we do it for oral conscious sedation at Palm Valley Pediatric Dentistry. Please share with me, let me know if you have any questions about oral conscious sedation. in office and what is criteria for it? Comment below, let me know, and stay tuned for more videos.